varicocele is basically varicose vein in a man's scrotum. Now, the reason men get this is very similar to the reason people get lower extremity varicose veins. There's a broken valve in the vein that's supposed to be draining the scrotum. That vein is called the gonadal vein. Because of the way it developed embryologically, it arises off the left renal vein, which is a vein up in the abdomen. And so what happens when a man stands up, the blood pours the wrong direction down the gonadal vein and fills the spermatic vein in the scrotum with blood, and over time that abnormal flow will cause the veins to get larger and larger and larger, so you have the varicose veins in the scrotum. Now, some of these are small and they don't cause any problem, but they can be unsightly, they can cause pain. If they occur when you're young, you can have testicular atrophy. The testes does not develop normally. And in some cases, it may contribute to infertility because the varicose veins warm up the normally cooler scrotum and will decrease the sperm count or possibly reduce the sperm motility. So one of the reasons we treat it is because of infertility. Traditionally, in the United States, varicoceles are treated by urologists, urologic surgeons, who make an incision in the groin and they clip the gonadal vein to stop the abnormal flow from going down. Now, that's not a bad treatment, that's fairly effective, but it is done under anesthesia in a hospital setting. There's a minimally invasive treatment, which we do, called gonadal vein embolization. And embolization is basically a catheter-based technique where we plug up abnormal vessels, arteries, or veins. And in this particular situation, what we do is we, under local anesthesia, possibly with some mild sedation, we get into the venous side of the bloodstream, either through the femoral vein in the groin or through the jugular vein in the neck through a little tiny incision. And then we thread our catheters through the renal vein and then down the gonadal vein, and then we close off the vein. There's a number of ways to close off the vein. The current preferred technique that I like to use is that we deploy or place some coils. A coil is a wire that has little fibers on it, and as it comes out through the catheter, it forms a round coil like a little pig's tail. And after you put one or two of those in, we then will inject a sclerosant, or a chemical, much like you would use for sclerotherapy of leg varicose veins, but we put it in the gonadal vein. And that kills the vein wall, but in addition it goes through little tiny secondary branches. Those branches are actually what cause some of the recurrences with surgical ligation. And so this is a second technique other than the coils to help make sure we're killing all the abnormal veins in the gonadal vein. And at the end, the bottom line is that when a patient stands up, the vein is closed and it no longer fills the varicose veins in the scrotum. And so they decompress. And so the unsightly veins, the pain from the varicosities goes away, and in a lot of cases the sperm count and the motility may improve.